As with any medical treatment, individual results may vary, and this experience is unique and specific to this patient only.
I was in the floral industry about 20 years. 10 hours a day, I was on my feet, a lot of walking, we were up and down ladders. It was very grueling. It was very enjoyable, but very grueling. I would say I've suffered from bunions a good 30 years. After I went to work full-time, it didn't take long, a couple of years maybe, I started noticing foot problems. It's hurt ever since, for years. I would wake up at night with pain, and I found myself limiting myself to how much walking I was going to do, and it really frustrated me. I went to a local surgeon, and they told me that I would have to be off my feet, not weight-bearing, for 6 weeks. He was just going to shave the bunion. I decided not to move forward with that surgery because I simply could not afford to miss 6 weeks of work. I just gave up, and I decided I'll just deal with the discomfort as best I can. I have a friend, an associate, that has done a lot in the orthopedic field, and I told him about my discomfort, and he told me about the Lapiplasty. He told me that the bunions weren't a bone just to be shaved off. It's actually a deformity, and he explained a little bit the surgery, and I was very excited about it.
When Nicole came in for her consultation, her presentation was very typical for what we see in many of our patients with severe bunions. She was very worried about having it corrected because there is so many bad stories about bunion surgery.
I had my Lapiplasty surgery August 3rd, 2018 on my right foot. I had surgery on a Friday morning and went back to see Dr. Dayton Monday morning, and he had removed the bandages, put me in a boot.
We're able to get patients moving quick. We're able to have them do exercises with their feet right away. We're able to have them up and walking in a walking boot within a few days of surgery, and then the vast majority of our patients are out of that boot and into an athletic shoe by the 6th week after surgery.
I saw my foot, and I knew I'd made the right decision, and it was going to change my life.
We check x-rays at 6 weeks, and Nicole was healing very well, and everything was aligned perfectly, and we were extremely happy.
Lapiplasty has improved my life drastically. Simply having a foot that I don't feel embarrassed to wear sandals, not deformed any longer, and I don't hurt anymore. And it's just enabled me to get out more, to do more, travel more, enjoy my dogs, my life. I feel awesome today. Life is good, my foot is good, and I'm looking forward to having my left foot. Same procedure with Dr. Dayton in a few weeks. I have a foot that no longer hurts. I have a foot that I can look at and I'm not embarrassed, I'm not ashamed. It has been a wonderful experience.
Only a surgeon can tell if Lapiplasty 3D bunion correction is right for you and what level of activity you can expect after healing is complete. There are potential risks with surgery, and recovery takes time. Potential risks include, but are not limited to, infection, discomfort from the presence of the implant, loosening of the implant, and loss of correction with non-union or malunion. Please consult with a physician for complete information regarding the benefits and risks associated with the Lapiplasty procedure.